All right, everybody, it's Rafe West. Excuse me. I should do that before I start filming, right? Um, in this video, I want to talk to you guys about um, doctor's appointments that men need. And I don't know if a lot of men do this, but doctor's appointments, mainly for everybody, but I'm going to focus on men. Doctor's appointments that you need and kind of how often. All right. And I want to address this because a lot of men, I think, don't go to the doctor enough or don't, excuse me for a second, or don't, well, never mind. They don't go to the doctor enough or they don't, um, what you call it, they don't know what needs to be done. So, first of all, your physical. So, you want to go and you want to get a primary doctor. And if you can, get a doctor who's a cardiologist. Some of them have certain specialties, and mine happens to be a cardiologist as his like main specialty. But get a primary doctor. Almost anyone could be your primary doctor. Just do a search. Make sure it's in network. Look for your at your insurance. They usually have a list of providers of who's in network. So you want to get your physical at least once every 12 months and sometimes twice every 12 months if you have any complications, meaning which kind of leads me to the next point of blood work. So at your doctor's visit, you don't want to make it like a business appointment. There's this reputation of doctors, they take 5 minutes with you, they talk with you as if you don't know what you're talking about. Go in with a little bit of knowledge, not only knowledge about yourself, but knowledge about the human body and what to expect. The white coat effect when they take your blood pressure reading for the first time. There's a thing called the white coat effect. You know, go into it with that little bit of knowledge that you're not just in and out of there in 2 minutes. So in your blood work, see, I bug my doctor. I tell him that I want very comprehensive. Now we do it automatically, but you want to test mainly for things like testosterone, that's total free testosterone. It's going to come with a lipid profile, meaning your cholesterol, your triglycerides, things like that. Um, Vitamin D is very um, popular these days to be included in a blood test. If it's not, mention it. You want your D3 tested, your B12. I even go a little bit deeper. We test for lead, um, hepatitis. I forget which one it is. A or C is now prevalent, especially if you're up there in age a little bit. Um, so you want to do blood work. And if you have any complications there, meaning anything, elevated cholesterol, total, or the LDL, which is the bad one, you want to go twice per year. Okay? So then, excuse me, folks. The other doctor, which is often neglected, is you want to go to a dermatologist at least once a year. A dermatologist will check your skin, remove any skin tags. Who hasn't gotten any skin tags? I call it part of Operation Sexy to remove any skin tags. They're very popular in the armpits, in the neck area, anywhere where the skin can fold and create friction. So almost everyone gets them, um, where skin tends to rub together. That's more of a cosmetic thing. But more importantly, you want to check, and they will do biopsies on anything that looks suspicious. I've had a couple done, any moles, anything like that, to make sure it's not cancer. So you want to do that at least once every 12 months, okay? Once a year. Dermatologist, find a good one. I found a really good one. I make a joke about him because anything I want taken off, he just burns it right off. Very good care. So you want to go to a dermatologist. Then dentist. Even though it's the dental mafia, I like to call it, drill and bill. You want to go at least for your cleanings, at least that, because if you don't, and there's a million dentists, same rule applies. Make sure they're in network. You do your cleanings. You do your cleanings at least twice a year. Pardon me for the pause there, if there was one. There was about a 40-second pause. I don't know if the camera was working or not. So it was showing up on the screen that it was not responding. So excuse me for the pause. Um, so the dermatologist will check you. He'll do a full body check, and if anything is suspect, he'll perform a biopsy, which is painless procedure. Do it, remove a little piece of your skin, send it over to the lab, and make sure it's not, excuse me, it's not, you know, anything wrong or bad. That clearing of the throat that you hear reminds me of another important appointment. If you use earplugs or if you suspect a lot of clearing of the throat, it could be a number of things. It could be anything ranging from allergies to reflux, um, to the really bad reflux, GERD, gastroesophageal reflux disease. It could be polyps in the mouth, in the throat. You know, this is all connected. The ears with the nose, that whole canal. So for that, I think it's good to go see an ENT. ENT, they will do various tests. They will put a scope. Um, do that at least once. It's a laryngoscopy, I think it's called, and it's a scope that goes down your throat, and they look with a little camera outside on a screen to see if you have any polyps, growths, tumors, anything like that. And then also in the same realm there, you can do allergy testing. I did it once. It's the equivalent, I think, of getting a tattoo, is the joke that I make about that. It's about several needles here, 50 to 100. I don't know, everything from dog to ragweed to. So you want to do that at least once, and then of course follow up. So you want to do that because from the neck up, your head is very important as well. Um, so yeah, other mandatory appointments. There's nothing else that's really mandatory per se if you're a man. Obviously, if you have any other issues, you talk with your doctor. That's why I say it's good if he's a cardiologist, because let's say, for example, you're having sexual issues. Um, Now, a lot of times, I know with my insurance, you don't need a referral to, let's say, if you were having issues like that, you can go to a urologist, or being that your doctor's a cardiologist, it's all about blood flow when it comes to sexual health. Not all about it, but mainly about it. So he would perform things like stress tests, um, EKGs, um, you know, other tests, sonogram, um, you know, um, for the heart, there's a sonogram. And all doctor tests are uncomfortable. I say it's almost like porn star stuff, right? All the positions are uncomfortable, like stunt sex. I like to call it. So it's all about being in uncomfortable positions. Hang in there. Think of it as like a porn star thing. You're in an uncomfortable position. You got to hold it for a while. Not natural. It's worth it. You know, it's your health. You got to try your best to take care of your health. So do that. I'm trying to think of any others. Those are the basic ones. Um, oh, and also, when you get your blood work, in order to add to your knowledge base, ask for a copy of your blood work. I always ask for copies of almost everything. Sometimes they give me copies of EKG. If you want, I guess you could take the graph and Google it online and look and see what the different points really mean. But the lab results, the blood work, that you can really go online and see what it means. And different labs will have different ranges of what's normal. So, you know, you have that. And that's basically it, you know. There's nothing else that I can really say. Okay. Yeah. So we will talk another time about all this and that. We will talk another time. I'm gonna keep this short, but those are the basics. All right. Maybe I'll make this a part one, but those are the basics of what you should get. Of course, anything extra for men. If you obviously have a foot problem, go see a podiatrist. If you know anything out of the ordinary, always go see. But it comes down to blood work. Um, Micronutrient testing is even better. I haven't done that yet. I did Wellness FX once when I was on the West Coast. It's like a more in-depth blood testing, micronutrients and things like that. I heard of something called SpectraCell, which I'm gonna look into, and you got to do at least that, guys. You know, and that's about it. You know, the outer shell, a little bit of the inner, and take it from there. All right, guys. So I hope this was valuable to you guys. Blood tests. You know, I'm surprised when I'm talking with a coworker or someone, a friend, an associate, and I ask, "What's your T numbers? You know, your testosterone numbers," and they don't know. They have no clue. That means they don't know their credit score. They don't know anything. Your testosterone is like your credit score for your health if you're a man. The higher, the better. All right, remember that, guys. Treat your T score like a credit score. You want to improve it, not damage it. So anyway, that's Rafi West's little rant on being healthy, like this guy here. All right. Health tips from Rafi West. Everybody take care, all you men out there, and be strong. All right. And have fun. Later.